Local doctors are seeing an alarming trend in COVID-19 patients. Delirium, a severe mental confusion and emotional imbalance. It comes on quickly and it's hitting patients of all ages. Laura Caso spoke with a doctor from the Cleveland Clinic today. Here's what he wants you to know.
Coronavirus targets the lungs, but the damage it causes can include other major organs, like the brain. Dr. Dhimant Dani, a neurologist at the Cleveland Clinic, says he's seeing an alarming trend. COVID-19 patients in the ICU with delirium, hallucinations, paranoia.
It is heartbreaking because you see them that they go through periods of severe agitations and confusion and paranoia.
And he's seeing it in patients of all ages.
And what's more alarming in a patients with COVID patient is that most of the time those deliriums tend to be more common in elderly patients, in a non-COVID patients, while we started seeing this younger patients who are developing those signs and symptoms of delirium that is very, very concerning.
But why is this happening? The virus and the treatment. Treatment for COVID-19 can include ventilators, sedation, even intubation. Life-saving, yes. But Dr. Dani says using these measures for a long period of time can also increase the prevalence of delirium. Lack of oxygen is also a contributing factor. He says about 60 to 70% of patients in the ICU develop some form of delirium. He also says many patients leave the hospital with post-traumatic stress disorder. So what can help? Dr. Dani says it's simple. Family. Virtual visits make a huge difference for patients.
Patients hearing the voices of their loved one, that could be very calming and soothing.
And it helps with the stress COVID patients are going through. Dr. Dani says prevention is better than a cure at this point. So practice the social distance, wear your mask, and remember, COVID-19 is still living around us, and we are still in a phase of uncertainty. Laura Caso, 3 News.